Hey, welcome back to another episode of Menopause Moguls, Navigating Midlife-ish with yours truly, Dr. Joyelle. Y'all, cholesterol has entered the chat. Cholesterol has entered the group chat. Anybody's group chat talking about cholesterol? I didn't change diets. I've been exercising, and boom, cholesterol is elevated. Cholesterol is trending upward. Like, what the hell? So we're going to talk about, that's what we're talking about today. We're going to talk about how cholesterol has entered the group chat and was not invited. Okay. We're going to normalize the shock. We're going to normalize the frustration. Maybe I'm just talking about me, but what the hell? What the hell is going on? This episode is really about understanding, again, also sharing my my very recent encounter with high cholesterol, and also a little bit different that I'm speaking about why this is happening. I guess it's not different. I just haven't really talked about, the intricacies, biology-wise, of the things that are happening within our bodies. A lot of the episodes I'm talking more about, empowering you and my insights and just lessons that I've learned of different things. And this is really, this is the same thing, but I'm talking a little bit about the biology or physiology of what's happening within our bodies when cholesterol is entering the chat. So I wanted just to add that to this episode. And I want you to all know that, if you are one of those like me who went to their doctor and said, your cholesterol is high and you feel like your body's betraying you, I want you to know that it's not betraying you. It's just recalibrating. Okay. And I'm basically sharing how I am really like in the thick of rethinking, redefining, reimagining what my body is doing, what it all means, and how to embrace it all, and avoiding embracing it, or avoiding the trap of falling into frustration and and anger. And I'll just say that those feelings did not come up, because they did. But not being trapped in it for a very long period of time. So let me just start by sharing just a quick story of how this all came about. Basically, I had a history of high blood pressure way back when. I, as you all know, that I have 3 kids. My first pregnancy, I developed preeclampsia, which is essentially a condition in pregnancy, or they also call it toxemia, where you have high blood pressure. And so I developed it after my first pregnancy, was able to, control my blood pressures, and was fine. And then my third pregnancy, I actually had elevated pressures in my second pregnancy, but also my third, which I actually needed to be induced for. And I had to be on blood pressure medicine after my third pregnancy. So that my son, which is my third child, was delivered in 2015. So I was on blood pressure medicine, probably stayed on for about a year. And I did not like being on blood pressure medicine. Let's put that out there. Okay. I am a doctor, but I'm the worst patient. I do not like taking medicine. So I like to avoid all the things if I can. Right. But at that time I had to take blood pressure medicine. Okay, fine. So I was on blood pressure medicine for about a year, and then I was able to get off of it with, changing my diet and exercising regularly and things like that. So that was 2016, right? Been fine. Okay. Been fine. And then, life has been happening. I've shared so much of my life that has been very disruptive, very, what other words can I describe it? Challenging. It's just been hard. Life has been hard. Life has been lifing. And there's lots of things that's been going on. And I've also shared that I'm in the thick of caregiving, so taking care of aging parents. And essentially, that has also been hard, right? And I have definitely shared practices where, although it's been hard, I've been very intentional about not losing myself in the process, right? Because caregiving can be so heavy and so challenging, where you can certainly just lose yourself in between, caregiving as well as raising kids and, again, doing all the things. So I have learned to not do all the things and become very intentional about taking care of myself and prioritizing my health and wellness. So as I've been doing that, I realized that even though I've been doing the things to pour into myself, which have been working, I think my body got to a point where it stopped working, right? Like the stress of it all became too much. And I ended up in the ER on New Year's Eve. And high blood pressure, very elevated blood pressure, headaches. I basically went in with headaches, numbness in my right arm, tingling, chest pain. So they basically, I went to the ER. I was immediately put on the stroke protocol, went straight to the head CTs, getting the CAT scan and all the things, right? So, and at that time, my mom was in the ICU. As you know, my dad is currently continuing to undergo treatment for his liposarcoma, and it's been, ups and downs with that. So it's just been a lot, right? And I think that, as the doctor in the family, as the oldest sister, I, certainly took on a lot. And like I said, I was good. I was good at prioritizing myself in the process. However, again, I realized that my mom went to the hospital, into the ICU. I think it just kind of tipped me over. And I realized I had to do things differently. But anyway, I think I'm going to do another episode about all of that. So I really want to talk about cholesterol in this episode. So, went to the ER, found out I was not having a stroke, thank God. And, but I was having elevated blood pressure. So I had to follow up with my primary care doctor, and, she placed me on blood pressure medication, and I'm like, I don't want to be on a medication. But they were, significant blood pressures. So I'm like, all right, fine. And I'm like, okay, but I'm still have the same plan as I did last time. I'm going to get off of this medicine and, be good. So took the blood pressure medicine, but she also wanted to check other labs like cholesterol and vitamin D and other things like that. So she did all that, and I had elevated cholesterol. So my LDL, which is what we call the bad cholesterol, was elevated, and my total cholesterol was elevated, and my HDL, which is your good cholesterol, was good, which is a good thing, right? So it was high, which is what we want it to be, right? And she also checked another blood test, which I was not aware about, which no one never mentioned to me about. It's called Lipoprotein A, and that was significantly elevated. So I want to talk to you about that a little bit later, and the significance of that. But because of all of those elevated numbers, the bad cholesterol, the lipoprotein, the total cholesterol, she suggested that I needed to be on cholesterol medicine. I'm like, really? I do not want to be on cholesterol medicine. Okay. That was not in the plan. So definitely immediate frustration and annoyance. I'm just sharing what I was feeling. And I started calling other friends, who are doctors, internists, some cardiologist friends. Like, what do you think about this? What do you think about that? Do you think I need to be on medication too? Like, what are your thoughts? And it was a consensus that, yeah, you probably should. I'm like, shit. Okay, fine. So I really had to consider all of the risk, right, of what it means when you have high cholesterol and the risk of that along with my high blood pressure. I just turned 50. Family history of stroke and heart attack, heart disease. Yeah, you probably should take the medicine. So I had to take all of that into consideration and embrace the fact that, okay, I'm going to be on this medicine. I still have the goal of not being on it forever, okay? Just to put that out there. But I had to come to accept where I was right now. And it can change later, right? But I had to be accepting of accepting of where I was right now and be okay with it, right? Because my body is my body and I only got one, and I have to work with her. I can't be resisting and being frustrated and in all the things and not do the things I'm supposed to do. So of course, I have, obviously pay more attention to what I'm eating as well as exercise. And we also talked about supplements. I'm going to talk about that a little bit later too. Okay. So let's first talk about cholesterol. So your LDL is like I said, what we consider the bad cholesterol. It's considered the bad cholesterol because of what it does. So in a normal, level, the LDL essentially, and I have notes, y'all, because I can't, my perimenopause brain just be forgetting stuff. So bear with me. But your LDL essentially in normal levels, it carries your cholesterol from your liver to your cells for like just normal cell repair. So it, does have a good function to it. However, when it becomes elevated and too much of it, it leads to this cholesterol being carried not just to the cells, but also to your arteries, which can cause blockage, which can cause high blood pressure and stroke and heart attack and blood clots and things like that. So that's why we call it the bad cholesterol. Your HDL is the good cholesterol because it's like the cleanup crew. But basically, it carries the excess of cholesterol from the cells and arteries and transports it back to the liver. So the liver can essentially break it down and just flush it from your body. So that's why we like the HDL. It's the good cholesterol. It prevents buildup of cholesterol in your arteries. It also decreases inflammation in your arteries and things like that. So we like the HDL, right? So it's a good thing. But many women have found, even though they have good healthy habits, they have been found to have high cholesterol in their 40s and 50s. Hey, that's me. And why is that? It's because what estrogen does before that, which essentially estrogen, its function when it comes to our cholesterol, it helps lower the LDL or keep it within a normal range. It supports the elevation of HDL. Estrogen also protects your blood vessels. So now when you're reaching menopause, going from perimenopause into menopause, your estrogen is declining, right? So you're now losing that protective effect of the correct management of cholesterol. So if your estrogen is declining, that means your LDL can be rising, your HDL can be dropping, your triglycerides, which is another a protein that essentially it stores unused calories and provides energy to cells, but it also can become in excess when your estrogen is declining. So all of that promotes inflammation, promotes clogged arteries, leads to heart attack and stroke, heart disease, right? And heart disease is the number one killer of women. Heart disease is the number one killer of women. And it can sneak up on you if you're not paying attention, if you are not aware. So that's why I really wanted to talk about this because of that very reason. We talk about, perimenopause and all the symptoms and what you can experience and things like that. But we also need to talk about the long-term effects when it comes to our health, specifically our heart health. And I think February is the American Heart Awareness month. So I definitely wanted to drop it during this time. But we don't talk about that enough, right? The risk of heart disease, especially around the time of menopause. And like I said, even before breast cancer, heart disease is what's killing us. So if we don't pay attention to our numbers, if we don't pay attention to what we're eating and how we're exercising, things like that, that is something that is detrimental, that can be detrimental to our health. So it also is something to be aware of what's happened with estrogen is because, like I said in the beginning, I was doing all the good things, eating right, exercising regularly, and I still got high cholesterol, right? Like, what is that? So reframing the fact that even though, you have high cholesterol, it may not particularly be due to bad behavior or bad habits. It can be just biology, right? Like, period. And so we cannot equate, us failing like, oh, I failed myself because, now I have high cholesterol. You didn't. You were doing all the right things, but your body was like, I'm going to do this now because this is what biology does, right? And there's also a genetic component, which I'm going to get to in a second. So I realized that, even though I was doing all the things and I was, quite proud of myself, my body was like, yeah, we're going to switch it up a little. And that's because estrogen is, declining, as well as, my stress levels were high, and cortisol is just messy, right? Cortisol is our stress hormone. It can just be messy. It can just wreak havoc on your body and lead to all these crazy things. So yeah, I'm just learning a whole lot when it comes to, looking at this cholesterol and, doing the things that I'm doing to prevent the risk or lower my risk of stroke and heart attack. So speaking of that, so this lipoprotein A essentially is a genetic factor or genetic determined type of the LDL, right? So it is a type of cholesterol that essentially is can be more kind of stickier in the arteries compared to LDL. So like when I mentioned before, if you have excess of LDL, that leads to a buildup of plaques and clots or different type of protein or cholesterol within your arteries. So the lipoprotein essentially just makes it even more stickier, essentially, and that can lead to clogged arteries and high blood pressure and increase your risk of stroke and heart attack. But it's genetically determined. I never heard of this until now. Okay, so I'm sharing it with y'all so y'all can be aware. So it is a test that my doctor wanted to check because of, because of the high blood pressure, because of my cholesterol numbers. And I have a family history of heart disease. My mom has high cholesterol, and my grandmother on my mom's side had a massive heart attack. I had an uncle on my mom's side who had a massive heart attack when he was in his 40s. So all these things are important, and all these things you yourself should know, just to give your doctor is the most information they can get, so they can determine what's the best fit as in regards to management when it comes to these numbers. So this lipoprotein A, I was told, like I said, strictly just like, what is that? Never heard of it until she, mentioned she was going to check it. But the jacked up thing is about this lipoprotein A is that, you check it, but you can't really do much about it because it's genetically driven. So you can do all the diet and the exercise that you want. The genetics is the genetics, and it really can't change it. But you can change the LDL and the HDL. So that is where, I'm learning that I can potentially lower my risk through that. because my lipoprotein A was very elevated, which increases my risk even more when it comes to heart attack and stroke and things like that. I'm like, great. Thanks for that. And there's some doctors who don't believe, just speaking to other doctors that I know, some doctors don't believe in checking lipoprotein A because they can't do anything about it. But I think it's just helpful information from my standpoint, just because, to confirm that genetically, that's working against me, to be honest. I'm doing all the things in regards to eating right, in regards to exercise, but genetically there's something that's still working against me that I have to be aware of. So for you, I think, it's important for you to be aware of this potential test that you can get. Talk to your doctor about, to see if something that will be warranted in your situation. So just so you know that you can be doing all the right things, but you still potentially can have a genetic component that can be potentially kind of working against you. So keeping that in mind. So you can ask for this test when you go see your primary care doctor, just to have that, information. So when I spoke to, like I said, friends and my doctor herself, I was just asking about other things that I can potentially use to help lower my LDL and cholesterol, because again, like I told you in the beginning, I am not a great patient and I don't like taking medicine. So if I can avoid taking medicine, I really would like to do that. So I asked what else I can do. Is there supplements, things like that? So there are supplements that are out there that potentially can help lower your cholesterol and lower your LDL. And those supplements, there's two. One is called red yeast rice, and the other is called berberine. Okay, berberine and red yeast rice. So these supplements have been shown to help lower LDL, improve insulin sensitivity. So those of you who may also have some evidence that you may be pre-diabetic and things like that. So those are possible supplements that you also can use to help with lowering your cholesterol. And again, I'm always a proponent of speaking to your doctor before you do anything when it comes to supplements. Like, I don't want y'all out here buying a whole bunch of supplements without having a discussion with your physician, because supplements, they're not benign. They can interact with other medications you may be taking or things like that. So it's very important. I wanted to mention it just because, again, I'm learning, I'm figuring things out, and I'm just basically tugging y'all along with me as I'm figuring things out. And I feel like I just needed to share those possibilities because I shared it in the group chat. We talking about the group chat. I shared it in my group chat as possibilities of things that you can also use to help lower your cholesterol. If you're not at the point where you need medication, you can certainly possibly use supplements as a tool to help with that, in addition to obviously your exercise and your diet. And when it comes to your diet, I've said this before, certainly plant-based is always the way to go. But avoiding, when it comes to cholesterol, avoiding high foods with high trans fats. You want to try to limit fried foods, things like that can potentially increase your cholesterol. So supplements certainly are, definitely tools that you can use or add to your regimen to help lower your cholesterol. But I think I want just to hone into the fact that there are many of us who are here are, trying to do the right thing when it comes to our health. We're exercising regularly. We are having a pretty healthy diet, right? Like I am not, a vegetarian or vegan or someone who avoids all sweets. Like I do like some cheesecake. I like, a little bit of fried chicken here and there. So, but I don't do it, obviously on a regular basis. I limit those things, but I don't restrict it, like, but I just don't eliminate it altogether. Like, so I do dabble, right? Like, what is it? Like the 80-20 rule, essentially. 80% I eat right, 20% I don't. Because I don't believe in restricting and eliminating things if I don't really have to. Obviously, if I really have to, I would. But if I can get away with doing a little bit here and there, I think that's okay. But I want you to know that as you are navigating, if you are someone who's also like, when did cholesterol, where's she come from? Like, why is she all of a sudden elevated and getting on my nerves? This is why, right? Your body is changing, your estrogen is declining, and basically you're losing that function of estrogen that was protecting your arteries and your heart. So now basically this is an invitation for you to do things differently, right? The invitation for you to now be more intentional about what you're eating, be more intentional about regular exercises. Definitely in adding resistance training is also very important. This invites you to be intentional about also regulating your stress levels, because stress also affects our heart health. When we talk about cholesterol, that's connected to our heart health, because heart disease, the risk factors for heart disease is high cholesterol and high blood pressure. And hey, I got both. So here we go. So again, I am sharing with you all as I am now navigating this new thing for me, as I just turned 50 last year. I am navigating this new thing of high blood pressure and cholesterol is when it comes to my health, and now figuring out there's also genetics that's, working against me. So I have to kind of take that into consideration and not beat myself up because now my cholesterol is high and I can't, we don't have to do that, right? So we can be, just have more self-awareness, like, okay, this is what my body is doing. I am not going to fall into, the rabbit hole of being frustrated and angry and mad and just say, F it. I'm not going to do anything. I'm just going to eat what I want and whatever. We're not going to do that either. So we are just going to do things differently. And that's what I'm doing. And that's what I invite you to do. And at the same time, being able to have this conversation with your doctors in regard to possible supplements that you can use, as well as different tests you can also request, so that you can just get a bigger picture of what's going on with your body when it comes to your cholesterol and the labs that are normally checked when you get your primary care, your physicals through your primary care. My vitamin D is also low. Hey, vitamin D, which is very common, especially in African Americans, because our melanin doesn't allow us to absorb it to a level where it, allows our levels to be normal. So a lot of us are vitamin D deficient. So I'm on now a vitamin D supplement. But I also learned that taking vitamin K2 is important when you're taking the vitamin D, because it allows better absorption of the vitamin D, as well as it directs vitamin D to your bones instead of your arteries, because when it goes to your arteries, that can also add to the plaques and the clogging of arteries, which can lead to inflammation, heart disease, and those fun things. So I've also added vitamin K2 to my my regimen. So I just wanted to again share with you all the kind of the ABCs of what's happening when it comes to cholesterol, because I've heard that cholesterol has entered a lot of group chats, and I felt compelled to share my own journey, as I have newly learned that I need to be on cholesterol medicine in addition to my blood pressure medicine. And it's a conversation that we definitely need to continue to have and share with each other. You on cholesterol medicine too, girl? Yeah, girl, I am. So that we can, be intentional about protecting our heart health. Because I said before, heart disease is a number one killer in women. And we really need to be proactive when it comes to how we are speaking to our bodies, how we are accepting of our bodies, what we are putting into our bodies when it comes to eating, how we are moving our bodies when it comes to exercise, and how we are treating our bodies when it comes to managing stress, because all of that matters and contributes to our heart health. So it's not, just managing the cholesterol levels, but also, again, going back to being intentional about really, truly pouring into yourself and taking care of yourself and managing your stress, because that can also add to the development of heart disease in these midlife streets. Okay. So you can, like I said, get back, reclaim your position in these midlife streets when it comes to your cholesterol. Cholesterol doesn't have to run the group chat. So you can be, again, just be more aware of what it all means when it comes to your cholesterol. But also knowing that when cholesterol, if it has showed up, does not mean that you have failed of what you're doing. It just means that your estrogen is now clocking out and you just have to do things differently. So, okay. So let me know if cholesterol has entered your group chat and what you are doing, and what you potentially are learning about your body and how you need to change or do it differently when it comes to taking care of it so that you can lower your risk of cholesterol, really essentially taking control of your health, and what you are doing to lower all of that risk and live healthy and well. I would love for you to share. All right, y'all. That's all I have for you today. Thank you for listening. Thank you for entertaining my just frustration of it all. Because I don't want y'all to think that I wasn't out here like mad for a second about all of this. But I've definitely come to a point where okay, it is what it is right now. There is, a possibility that, I certainly can get off of all this medication. It's possible. Okay. It's possible. That's all I'm going to say. It's possible. But I am not going to, be in a space where I'm just frustrated the whole time, and I'm going to do what I need to do. Again, take care of my body, just do it in a different way. And we'll go from there. So I'll keep y'all updated and let y'all know how it goes. I'll let you know if what I've been doing has helped my levels when I go back to the doctor later on, this spring. So yeah. All right. So if you think this was helpful, please share it, with all your friends, your sisters, your people, so they'll know. Because again, it's a conversation that, that we need to talk a lot more about, because, like I said, heart disease, we need to definitely be more intentional, and proactive, in preventing that for us. So, all right, y'all. Love and light to you all. Until next time. See y'all later.